Hi, everybody. This is the latest of our members' education sessions. My name is Chris Carrigan. I'm the data advisor for Use My Data and part of the Secretariat. Put these sessions on fairly regularly. There'll be a slight break over the summer, but we try to run them every few weeks. The topics normally come from our members. It's a slightly different one because on the back of the conference, we wanted to get the various conference sponsors to come and talk to us either before the event or after the event, as they preferred. So this morning's session is following up on that conference with two of our main sponsors, PEDRI and Health Data Research UK. Samaira and Esther both here, as you can see, and we'll let them speak in a second. But this morning's really about listening to Samaira and Esther talk about their various work with HDR UK and PEDRI. So without further ado, I'll hand over to the two of you. I think, Samaira, are you going to start?
I am indeed, yes. Thank you so much. Hi everyone. I'm Samaira Khan, Senior Partnerships Manager and Operational Lead for PEDRI, which has nothing to do with the Spanish footballer. We are the Public Engagement in Data Research Initiative. Somebody asked me, when are you going to stop saying that? When are you going to stop referring to the Spanish football? I was like, never. For those people that know about football, they recognize it, but others just look at me like, what's she talking about? And so I'll just talk you through PEDRI and what we're all about and give you some background in terms of the context and the work that we do. So in terms of our founding and membership, PEDRI was founded by Administrative Data Research UK, Health Data Research UK, and the Office for National Statistics. And it was founded by these key four organisations to kind of launch and drive forward meaningful public involvement and engagement in the use of data research. So we're very much a sector-wide partnership across the data-driven research ecosystem. So from academic institutions and public bodies to data custodians, our focus is on data that has a real impact on people's lives. So that includes health data, administrative data, education or social records, and also statistical data and through surveys and censuses as well. So we're very much data agnostic. We cover both health and non-health data. And we also collaborate with industry as well. And this is very much about increasing the active people that are increasingly active in this space. So the idea is really to ensure that wherever and however public data is being used for research, there's a high standard of trust, transparency and public involvement guiding that work, which is really crucial. So you can see here our partner organizations, and we have grown from 3 organizations when we first started in 2022 to 18, which is great. And just in terms of our mission as well, it's very much to unite organisations across the UK's data-driven research and statistical sector to continuously improve public involvement and engagement in policy and practice. So we're very much a convening entity, but part of our work is also about enhancing our partners' efforts in doing public involvement and engagement. So we work closely with our partners as well. So this slide is very much about our kind of strategic objectives and what PEDRI stands for, and it generally falls into these categories. So our strategy was built around these 5 objectives that have been developed in collaboration with our partners and stakeholders, and each one reflects a priority area where we see opportunities to work together and to strengthen public involvement and engagement across the data research and statistics landscape. So collaboration and partnership, we believe this is very much key to amplifying public voices in data research. So by working together across organisations and sectors, we increase the reach, diversity and impact of public involvement and engagement. And our partners also partnership model also helps to kind of avoid duplication of effort, share resources. And we also see this as being more cost effective as well. So through joint working groups, roundtables and shared initiatives, we're creating spaces for honest and practical solutions as well. And this also kind of helps with the sustainability as well in terms of the longer term. Our next objective is around good public involvement and engagement practices. So we're committed to embedding practical and meaningful approaches to public involvement and engagement that are specific to data research and statistics. So our good practice standards set kind of a strong foundation for this, and they clearly set out what good looks like. And we're now focused on how to apply these standards in real world settings. So making public involvement less complex and more accessible and impactful. So our upcoming evaluation evaluation tools and frameworks and case studies will really help demonstrate what's working, why, and ensuring public involvement and engagement is not just done, but actually done well as well, which is really important for us as part of this objective and work. And then two-way communication. So this is about effective engagement, starting with listening, building stronger two-way communication channels that allow us to better understand public concern and respond where we can. And then learning and development. So we've done lots of work in trying to kind of understand the community needs. And we know that many researchers and public involvement practitioners want to do more, but don't always have the tools or confidence to get started. So our resources working group has kind of helped identify and fill those gaps. So whether that's through training or practical toolkits, we've developed a resource hub, which is kind of like a one-stop shop, which includes kind of all resources that are specific to data and statistics and public involvement and engagement. And through this learning and development, we want to support the community to the good, meaningful involvement and engagement. And then creating a culture of public involvement and engagement. And this is really key. This is our kind of ultimate aim. We aim to embed PIE into the culture of PEDRI and the wider ecosystem as well. So shaping projects, communications, and decision-making in ways that are genuinely inclusive and co-produced as well. So so it's very much about trying to normalize involvement and engagement across the sector, which is really important. And then equity, diversity, and inclusion. Initially, we had this as a separate objective, but then we agreed that actually this is something that we should be weaving into everything that we do and considering throughout all our objectives. So that's exactly what we've done. We've tried to ensure that this is something that's embedded rather than a standalone priority. So just in terms of our key achievements for phase one, we've spent a long time since 2022 trying to build a partnership and precedents for collaborative working. So as I mentioned, we've grown from just 3 founding organizations to 18. And I think the rapid expansion as well in terms of how we're growing recognizes the importance of public involvement and engagement in data and the value of actually working together to drive meaningful change, which is absolutely crucial. And then setting the standard for public engagement, which builds trust. So this is very much about kind of the good practice standards, which we feel is a kind of major step towards building confidence in how data is used. And these standards do provide a clear and actionable framework to help organizations embed trustworthiness, transparency, but also meaningful engagement into their work. And then I mentioned earlier about kind of identifying community needs as well and understanding these. So we've actively engaged with diverse communities and stakeholders to identify the gaps in public involvement and engagement. And these insights are kind of helping to shape PEDRI's direction and ensuring that our work addresses the kind of sector-wide challenges and public expectations as well. And then the resource hub, we've developed the resource hub, which continues to grow. I think we've got around 80 different resources on there, and we have a whole process of making sure that the language used, and we create a plain English summary, which is reviewed by the working group to accompany the resource as well, so it's accessible, and that's all on our website. And then we also have a dedicated work streams as well around each of our objectives. And you will have seen, for those of you that have been around for a while or have been following PEDRI, you'll have seen that our branding has changed as well, and we have a new identity. We did feel that the previous branding didn't really reflect what we were about, so we did some work around rebranding as well, and you can see the new logos and things like that we created. And then I just wanted to touch on the good practice standards, because these very much underpin everything that we do at PEDRI. And it's been a 2-year process where we've worked with the data and statistics community. So we started off by a first draft where we included 62 participants and had 2 initial workshops to shape the first initial draft. We then created the first draft, and this was followed by further consultations, a public consultation survey, which included 139 responses. And this then helped kind of refine that draft. And we followed up with further 3 consultations, and we had 96 participants as part of that. And this was the whole data community, data custodians, researchers, but also working closely with the public as well, to help refine that. And the final version looks like this, which hopefully you'll have all seen or had sight of. And the QR code there gives you access to the more comprehensive version. And I won't go through all of these because you can have a good read through. But I wanted to share this quote, which I really like, that it's not about getting people to trust you, but it's about demonstrating trustworthiness. And I think this is really, really crucial, that, you know, trust is really difficult to kind of gain, and often it can be really challenging, but instead it's about consistently demonstrating qualities and behaviors that naturally inspire trust. So in other words, it comes from actions that show honesty, reliability, competence, and integrity over time. And that's what we try and do by working with our partners to be able to kind of enhance trust in data and statistics. And then this is just a forward look in terms of what's happening next. Chris, you've seen this slide, I'm sure, several times, but it just gives you a kind of forward look on what's happening next. So now we've published the final version. I mentioned that we're now developing an evaluation tool. So Esther leads the standards working group and the work around the standards. And we're developing this framework to be able to evaluate how the standards work in practice and create some case studies and real world evidence. But also it is an opportunity to learn, to see how these work in practice, and a continuous learning process. We've also launched the Good Practice Standards Funding Award as well. This is now available on our website. So we know that resource can be a huge constraint when it comes to doing involvement and engagement. So we've provided grants of up to £15,000 for organisations to apply for this grant to embed and adopt the good practice standards. And from that, we would like to see kind of case studies and reports of how they're actually doing good patient involvement and engagement as well. And then we're also exploring a kite marking system. So currently the working group is looking at an exploratory phase of whether that's something that would work for the standards as well. And we'll also publish on a peer-reviewed journal as well. So we're doing a write-up of the work that we've done so far as well. And then very quickly, I just wanted to touch on some of the partnerships and collaboration. So we have a really new, exciting project where we're working with Cancer Research UK and some colleagues from the University of Manchester on a project where we're engaging young people in cancer data research. So this is very much about a scoping exercise to explore the feasibility and acceptability of a digital platform to engage children and young people in research through this digital platform. So PEDRI is looking to kind of do a scoping exercise to engage with the public members to explore whether it's acceptable, what's not acceptable, and looking at, you know, how we can kind of what that would actually look like. So we've done lots of work of looking at what's already out there as well, and we've been speaking to people that have done some fantastic work with children and young people. So really exciting. I think there'll be lots of opportunities in terms of learnings with working with children and young people. And I'm sure there'll be lots of challenges which we can kind of explore possible solutions to as well. So yeah, we're really keen to get this project up and going. And then learning and development, I've talked quite a lot about the resource hub, but we continue to kind of learn and explore different opportunities to work with different partners around training and exploring the gaps as well. And then engagement and communication, you'll have seen that we've started launching our webinars as well. So all our webinars are aligned to our good practice standards. So we have one around equity, diversity and inclusion, one around communications, one around transparency. So the next one is around prioritizing equity in public involvement and engagement in data research. And that's next week. So do join if you've not signed up already. We're also on LinkedIn. We've been going to lots of different festivals, including the Rochdale Science Initiative, which just a fantastic opportunity to kind of speak to the general public about data. And we've been doing lots of fun stuff like Hook a Duck and things like that to help them understand different data types and to help kind of children and young people get more engaged as well. We've also been working with the European Patients Forum as well, and we were invited to Italy, and you can see here Doreen Tembo, our strategic lead, was one of the chairs at the event, at the patient engagement forum in Italy, which went really well. And they also have a conference in Milan later this year. And they have also published our good practice standards on their website, which is just fantastic to see because they're really keen to kind of embed this across the work that they do as well. And it's likely that we'll be doing something at their conference as well later this year. So lots happening, lots of engagement and communication work as well. And then, as I mentioned, it's very much about trying to normalize involvement and engagement in data and statistics. So we have created a PEDRI pledge as well, which is now on our website. And this is a kind of public declaration to the good practice standards, which organizations can sign up to say, you know, these are standards that we are going to be following. And once they sign up, there's a kind of a support network. There's also a toolkit that we provide to them. So lots of opportunities there as well. And then this is my final slide. Just in terms of phase 2 and the sort of things that we're kind of looking at next, we're looking at strategic expansion. So we've got lots of organizations that are part of PEDRI that are very health focused. So we're trying to bring in more non-health organizations as well. So we're looking at kind of environmental data as well, different organizations that we can work with. There's a real focus now on the good practice standards work. So the public pledge, the adoption, the evaluation framework, and looking at accreditation and monitoring, evaluation and learning as well. The Good Practice Standards Funding Award, following that, we want to develop a community of practice, which brings together all the funded applicants to come and share how they've worked with the standards and kind of learn from each other. So really providing this platform for shared learning. And as part of that, we would like to do a kind of a showcase kind of event, but possibly next year, where, you know, these projects that have embedded the good practice standards showcase how they've done that and share it with the community. So it's all about sharing knowledge, you know, and best practice. And then thought leadership and community approach to challenges. So we have a roundtable that's coming up on the 24th of September around equity, diversity and inclusion. And this again has come from our partners, that there needs to be a discussion around involvement and engagement and what that actually means in the context of data and statistics. And then also working with the kind of National Data Library and the Office for National Statistics as well. I will stop there and stop sharing and hand over to Esther.
So a few more minutes and then hopefully we're going to hear from you. But yeah, so I'm Esther. I'm the Patient and Public Involvement Engagement Senior Program Manager at Health Data Research UK. And as part of my role, I do work with a team of involvement engagement leads that try to improve the practice and involvement and engagement of members of the public in Health Data Research UK work. I'm not sure how many of you are familiar with Health Data Research UK, often referred to as HDR UK, but it is a charity funded by 9 different funders and has a specific mission, which is unite health data across the 4 nations to change people's life. So with respect to what the patient and public involvement engagement team in particular is trying to do, and you know what our mission is very much related to the 4 goals that you can see in these slides. And they do try to kind of tackle the key challenges that we realized are still out there in the space of health data research. And the first one is very much focusing on patients, the public, researchers, PPA, colleagues, and practitioners are our partners in decision making. We want to make sure that this is happening, as a lot of the time that hasn't been the case. We also want the need and interest of the public are understood and embedded in the work that we do, that we commission, that we fund, that we conduct. We'd like to ensure that trust and confidence in the use and reuse of health data for research innovation are encouraged among diverse UK communities. And finally, given the mission that we have, of course, we really want to deliver this and all the activities that we have in partnership with all the key actors at national and potentially even international level to make sure that we do advance the involvement and engagement specifically in the health data space. And over the last few years, we've been working with different partners already, but these ones have been very key in shaping what would have come next, because HDR UK was established in 2018 and has been growing quite fast since the very early inception. And since 2023, we've been trying to evaluate what has happened at the very beginning of HDR UK and where we could go, evaluating what worked well, what did not work well, and what was, of course, the change in the context that happened, even thinking just about the COVID-19 and how that changed the way research is even conducted within health space. So as you can see at the top, we do have the VPIE team, and we do work quite closely with the Public Advisory Board. The current members are this one in the picture, and they do work quite closely with us at strategic level. They influence the governance of Health Data Research UK as an organization, in addition to, of course, influencing and shaping our plans and working with us to deliver them. We also have the HDR UK Voices. That is a network, and some of you might be aware of this network, might even be part of it, which counts up to 300 members, and it's people interested in health data, and they want to hear from us, whether it's about project and a progress of a project that we are conducting, or just getting involved with our work or our partners' work. Then we do work with several leads, and this is a picture from one of our last meetings across the organization. We are placed in different nations. We do work also in different institutions because HDR UK funds projects that are delivered a lot of the time in partnership with universities, for instance. So they might not be based within the same team that I am, but we do have this group just to make sure that we avoid duplication and we increase collaboration. Then there is the PEDRI team. Samaira has already talked quite a lot about the PEDRI team. And then there is a strategy steering group. This group was established in 2023 after the evaluation that we referred to, because there was a clear understanding that we can't change, and tackle the challenge that we have identified on our own, that there are definitely key players that have been doing that for quite a long time. They are doing that still, even though it might have different agenda or different nature. And so we wanted to put together a group, and the logos there are of the organization that are currently sitting on the strategy steering group that has been changing over time. And then we'll go through actually a recruitment soon, as well as for the Public Advisory Board. But this is a little bit, we go through normal and iterative approach, going constantly on trying to make sure that we are inclusive as possible in our approach. This is a little bit of an overview of the type of activities that we do. And as the title kind of, I don't know if it resonates with reality that you experience sometimes from your perspective, but we constantly need to be informed about what is going on in the world out there. Patient and public involvement engagement does not happen on isolation from everything, and is highly influenced by decision-making of the government policy makers, but also from anything, any social activity or event that might happen and might be part of our life. So a lot of the time we had to kind of reinvent ourselves in the way we were doing things or the activities that we were planning, and members of the public were really crucial into that. And as you can see here, we do definitely deliver something in collaboration with the shared commitment to public involvement, and we are involved in that, very much committed to the UK standards for public involvement. We've been running campaigns to raise awareness of how health data research can change life. And these Dave's stories, part of a campaign that Voice members were part of, which was about telling the story of real people, of how health data research has changed their life. Signing up, of course, to Voices, as mentioned, you could work with us, but we've been attending different science festivals over the past 3 years in particular. And we've been trying to also affect, as mentioned, decision making. It is not in our remit, we cannot directly do that, but getting involved, for instance, in the Sadler review, we did have several Public Advisory Board members and Voices members contributing in the workshop, informing the Sadler review, and replying to call for consultations and supporting our public members community to respond from their own perspective, for instance, to the NHS consultation, to respond to the very first report on health data a few years ago, the Calder Prayer Review, and also the Information Commission Officer, and what and how they might affect the reports around personal data, health data, and sharing or even linking data. This is a very quick snapshot of some impact that we've had. And there is actually a 2-minute video that is going to come up soon on our social media on HDR UK, Instagram, and LinkedIn accounts. And these are just a few highlights. Rather than the very first time that a strategy was created, this time we really put an effort in trying to engage as many people as possible. And most of the 174 are actually members of the public, and they do not include also our colleagues at HDR UK. We didn't have a PPIE leads group. That was a need identified. We were not doing that well on the very first round. So one of the very first mission was, let's try to avoid duplication and work together under the same umbrella that is HDR UK. So we do have a group now that from 0 went to 36. We do have our public advisory board that do following some changes within the way they work with the organization has influenced the governance of HDR UK. Very recent example over the last year, they've been very much challenging that there is a UK on AI. And we are now developing and working on a strategy and a work stream that wasn't in the original plan of Elders Raise UK. As mentioned, we do have a network of approximately 300 people. We have contributed to shaping policies very respectfully since the Sadler review mentioned. Our stories campaign was viewed by 800 people, and that was, of course, great because at least we tried to raise awareness and we reached a huge pool of people. And then approximately we had 200 encounters, 2,000, sorry, through science festivals over the last 2 years, a total of 7 as per the 3 just conducted between June and July by the team. Still a way to go. Yeah, I just wanted to conclude saying, we've done quite great and we've learned from what wasn't working well, from what we weren't doing well, or from what actually members of the public and patient needed the most, which was really important to hear even before making plans about what next. But I think I wanted to kind of leave you all, and please feel free to let me know your thoughts. I think there is still a way to go to make sure that research is relevant. And when I think about, of course, research, I do refer with respect to the health data research space, how we can make sure the members of the public, that patients have a voice and give direction to what is done, but also how it's done and what is the result of it. How we are going to be able to reach underserved and underrepresented community, and even more people, those members of the public that are not engaging perhaps because they don't know, they might not be even interested, or again, they might not know that there is an option for there is a possibility for them to have an impact on what happens in health data research, and then influencing the big picture. As mentioned before, we can't act in isolation. This is way bigger than health data research UK, but following a little bit what Samaira said, is also bigger than health data, because a lot of the time, the research that we also do at Health Data Research UK is linked to whether it is administrative data, whether it is social and environmental data, because all of these are determinants potentially of health status. So it's really important that there is some sort of like collaboration that influence any sector within the data space and affects also how research is done. So the research infrastructure. And that's me. I will stop sharing now.
Thank you both for that. That's really handy to see both those things back to back. I'll leave the recording going because I think that drives the transcript, and what we've done for recent ones, we've tried to record the questions that people get asked rather than saying who asked those questions. So I'll leave the recording going for those purposes. Just a quick reflection as you get your questions. What's pretty obvious, we saw it at our conference, was there were a lot of people working in this patient involvement, patient engagement space. Ourselves, we've been around for a while, as PEDRI, HDR UK, and many others. So I think it's really important that we understand collectively what those different organisations do rather than just sitting back and see what they do. And that was really the purpose of the discussions today. You've already seen there's a huge amount of crossover, but there's equally extension. So PEDRI are involved not just in the health data view, but other data. And yet they've already got working with Cancer Research UK on the Young Persons Project, and Cancer Research UK are a co-funder of ours. So you can see how all these things begin to link together. And the point that Esther was making at the end about bringing their own patient voices into the responses to national consultations, such as the Gold Acre Review, Sudler Review, Transparency Standards. We also do those things with our members as well. So there's a huge amount of crossover, which I think could be a big challenge for us all moving forward, to make sure we don't tread on each other's toes, but work much more collectively. Anyway, just like to say thank you everybody again for giving your time. I'm sorry about the Zoom problems getting in that people experienced, but I really appreciate it. Have a lovely weekend, and we'll see you all very shortly.